Hi everyone. Today let's talk about non-organic hearing loss, also called as functional hearing loss, or these are the tests for malingerers. Malingerers is a person who says that I am not able to hear in one ear or both ears, but actually he can hear, but he is lying so that he can get some benefit in the form of compensation or something. Non-organic means there is no organic lesion, and so there is no organic lesion means it is basically normal, also called as functional hearing loss. Okay, in that the first test is called the Stenger's test. Excuse me, Stenger's test. It is useful only when you suspect that the patient is feigning deafness. Feigning means he is pretending to be affected by, or he is feigning that I'm deaf only in one ear. It is not useful if both ears have to be tested. So Stenger's test is useful when a person is pretending that he is deaf in one ear. What is the principle on which this test is based? It is based on the principle that if a tone of two intensities, so here 1 year we are giving a 30 decibels to the right ear and 50 decibels to the left ear, and they are at equal distance, whatever, say 15 centimeters or 25 centimeters from each ear. They are at the same distance from both the ears, and when you present two intensities, the ear with a greater intensity can hear it. So this is the basic principle of. So the principle says that if two tones of different intensities are presented to both ears simultaneously, both ears we are presenting the sound simultaneously. Only the ear which receives the tone of greater intensity will hear it. The ear which is receiving the tone of greater intensity will hear it. This is the principle of the test. So how do we do the procedure? So here the patient is blindfolded, so patient cannot see what is happening. You can either do it with two tuning forks or you can do it with audiometer. So what is the procedure? So let us, for example, let us imagine that this patient is having left-sided real deafness. So he's having a left-sided some pathology in the ear, which is causing him to have deafness, which is significant, like maybe 60, 70, or 80 decibels of hearing loss. So it can be conductive hearing loss, or it can be sensorineural hearing loss. So it can be anything, but he's having a real left-sided deafness. So you take two tuning forks, okay, of the same intensity. That both the tuning forks are of the same intensity and they are presented at the same distance from the ear. Okay, so left side is the deaf ear. So he will say, yes, I can hear only in the right ear. He says I can hear only in the right ear because his right ear is not functioning normally. Left sided is not functioning. So whatever sound is presented to the left side, he will not be able to hear. Now, as a part of the test, what we will do, we will bring this tuning fork on the left side where he's having real deafness, 8 centimeters to 8 centimeters. Instead of 25 centimeters, we'll bring it to 8 centimeters. So we are closer to that. So what happens, this becomes the tuning fork with a greater intensity. But because this side is deaf, he cannot hear anything on the left side. He says, I can continue to hear this tuning fork on the right side. So this is what happens when a patient is having unilateral deafness, real deafness, not functional deafness. Okay, so two tuning forks of the same frequencies are presented at equal distance. The ear which is hearing can hear it. Even if you bring this closer, he can hear the one which is already hearing, because it's the only ear that is hearing. Okay, I guess you understood this. Now suppose this patient is feigning deafness on the left ear, so he's malingering on the left side, one-sided deafness only. So we start the test in the same way. We blindfold the patient and we place two tuning forks at 25 centimeters distance on both the sides. He says, yeah, I'm having left-sided deafness. So he says, I can hear only on the right side. Okay. Then what do? We bring this side, on the side that he's saying he is deaf, we bring it closer by 8 centimeters. So this is the sound where this side he's going to hear louder sound on the left side. Now he's not going to hear anything from the right side because this is a tone of greater intensity, so he can hear only on the left side. But he has already claimed that this ear is deaf. So he says, I cannot hear anything. Patient says, I cannot hear anything. But actually he should continue to hear in the normal ear or the right ear. He should continue to hear in the normal ear, right ear. But he says, I cannot hear anything because this is the sound, this is the side where he is going to hear. The right side he cannot hear anything. Because this is a tuning fork of greater intensity, he can hear it. So this is how we can catch those people who are saying that they are normal basically, but they are saying I'm deaf in only one side. Okay, so this is based on the principle that a tone, if two sound tones of different intensities are presented to the ear simultaneously, the ear which is having a greater intensity can hear it, the other cannot hear it. So with that principle, we try to pick up those people who are claiming to be deaf. So this is basically a subjective test. So it depends on the patient. Okay. Then what is Lombard test? Lombard test, Stenger's test is for unilateral deafness. This is for suspected bilateral functional hearing loss. Both sides patient is saying I cannot hear. Okay, so this is based on the principle that a normal person raises his voice in the presence of background noise. So what do we do the procedure? So this is based on the principle that a normal person raises his voice in the presence of background noise. How do we do this test? We ask the patient to read a paragraph. We ask him to read aloud. We ask him to read give him a paragraph and ask him to read aloud. Okay, and then a sudden noise is presented in the background. Sudden noise is presented in the background. A normal person who can hear what he does, he raises his voice to compensate for this increase in noise. He increases his voice, and this indicates that he can hear the background noise, and this is a case of functional hearing loss. So let's just repeat the Lombard test. So this is done in the cases of suspected bilateral functional hearing loss. Okay, so this is based on the principle that a normal person raises his voice in the presence of background noise. So when I ask a patient to read something aloud and suddenly present a sound from behind, a sound is presented to the ear. And if he is feigning deafness, if it is a case of functional hearing loss, he will raise his voice. If he is having a real deafness, he will not raise his voice. So this is the Lombard test. Stepidial reflex. So stepidial reflex is basically an objective test. It is an objective test. Okay, what is stepidial reflex? A tone 70 to 100 decibels greater than the threshold of the patient is presented to one ear, and the stapedius muscle is going to contract as a reflex to that, and that can be picked up in the same ear or in the contralateral ear. So what happens? The sound from the cochlea, 70 to 100 decibels, is presented to the cochlea. So that goes to the cochlear nerve, from there to the superior olivary complex, and then to the motor nucleus of the seventh nerve, and that facial nerve will cause contraction of the stapedius muscle. So the patient is, suppose the patient is claiming to be deaf. So stapedius reflex is normal, means the entire pathway is normal, entire cochlea and the cochlear, the auditory nerve, the cochlear nucleus, entire interconnections are also normal. Everything is normal. That is the meaning that the stapedial reflex is normal. The patient is claiming to be deaf, but you present a 70 to 100 decibel tone to the ear, then he will get a stapedius reflex. Then the patient is malingering. If it is having a real hearing loss, then the stapedius reflex will not. There will be no stapedial reflex on the right side and the left side, because there is no information only. Information will not pass at all to the unilateral cochlear nucleus, which will not pass on to the superior olivary nucleus of the same side or the opposite side. So if the patient is really deaf, he will not get a stapedius reflex. If the patient is not deaf and he is malingering, then there will be stapedius reflex, and that's how you can pick them up. Okay. What is speech audiometry? Speech audiometry is, in speech audiometry we use speech reception threshold, SRT. Okay, speech reception threshold. What did we say about speech reception threshold? We said that it is the minimum intensity of sound where the patient can repeat 50% of the words that are presented to him. Okay, so that you will get some speech reception threshold, say 30 decibels or 40 decibels or something you will get. Okay, that is the speech reception threshold for that particular patient, and that should correlate with the Puton audiometry results. So Puton audiometry, if you take 500,000 to 1000 hertz, then that whatever you will get in the Puton audiometry results, say in this patient it is 45 decibels. So speech reception threshold should also come as 45 decibels or maximum 35 to 55 decibels. So within the 10 decibel range. So it should within 10 decibel range of Puton audiometry threshold. If the difference is more than 10 decibels, it indicates that the patient is malingering. Also, if you repeat the Puton audiometry, if you repeat the speech audiometry, and he is not giving same results all the time. He is giving like sometimes more, sometimes less. So there are inconsistencies also. When you repeat Puton audiometry or speech audiometry, that also points to malingering. So this is a subjective test. BERA. BERA, this is Brainstem evoked response audiometry. you give a tone to the patient and you pick up the reflex with a electrode on the vertex. So this is totally a this is totally an objective test and one of the best tests for best audiometric test for non-organic hearing loss. So if you give a sound to the ear and you can pick up all the waves, then it means that the patient is having functional hearing loss and what he is telling is wrong. Okay, so this is about non-organic hearing loss. Thanks for watching. Please do like, comment, share, subscribe if you find the content useful. Thank you.